Hello, everyone. This is Sharon Heller with Network in Action in Denver, and I'm here today with acupuncturist Mark VanOtterloo. Hi, Mark.
Hey Sharon, thanks for having me.
You're welcome. How are you today?
I'm doing well. How are you doing?
I'm good too.
Excellent, excellent.
Good. Well, I was looking forward to talking to you today because, as you know, you're one of my favorite health practitioners, and I've been thinking a lot about health and wellness, especially during this time of COVID and, just everyone's awareness, I think, is pretty heightened around taking care of the body and thought it would be a great time to talk with you.
Yeah, no, that makes perfect sense. I think that chronic disease is kind of on the front of everyone's mind since that is one of the more complicating factors of COVID-19 right now.
Yeah, and in thinking about the patients that you've already been serving, that you already have a history with, what are you noticing in terms of how your patients are being affected and how they might be seeking you out, maybe in different ways than they did in the past?
Yeah, that's a good question. There's not too much change for me. My focus is on chronic disease, so I'm still getting the same patients that are seeking me out. I focus on fertility on the chronic disease side of things, autoimmune disease, strange conditions, and chronic pain, and that really seems to be kind of consistent, a consistent patient load there. So not too much change there, but the office environment has changed a lot though. We're having patients wear masks. I'm seeing less frequent patients so that I can clean between visits as well. So there is a change there, but in terms of whom I'm seeing, pretty much the same.
Yeah. Are you finding that they're having different questions for you or kind of grappling with different aspects of their care in terms of looking at their health overall?
Yeah, yeah. Again, as I was saying before, chronic disease is on the front, the front of everyone's mind. So there are a lot more questions about them, and surprisingly, many chronic diseases have a similar foundation to them. They arise in our society because we've had massive changes in technology. If you consider since we've been hunting and gathering all the way to the agricultural revolution and now the industrial revolution. And to me, on the chronic disease side of things, we have all of this technology, but we haven't developed wisdom around that
Mm.
to figure out how to integrate that within society. And from that, you start to see chronic disease show up. And so you think about something as innocuous as like a light bulb, amazing invention, but at the same time, we're getting light pollution and we're not being exposed to the same amount of light and dark cycles that we were before. And so we're seeing massive changes with sleep cycle from that.
Mm.
And so a lot of my conversations that are occurring with patients are having to do more with trying to integrate new levels of wisdom because we can't go back. We can't go back to living like our Paleolithic ancestors. But at the
Mhm.
same time, it's like, well, how do we actually biohack this for now? Something as simple as like wearing orange tinted glasses at night. It might look strange, but for someone with sleeping issues, that can actually make a pivotal change at their ability to produce the chemicals for sleeping.
Oh, as always, I always learn a lot when I talk with you, and I feel like the expertise that you offer your patients kind of goes beyond what I think of when I think of like traditional acupuncture. Like it's just about needles. There's a lot more to it than that.
Yeah, yeah. When you think about what I do, it's like a traditional surgery. It's a little bit different than modern surgery, obviously, but we are. So for me, one of the things I do a lot of research at, or academic research, is in the Neijing, or the foundations of acupuncture, because there have been cultural revolutions that have happened. There have been mistranslations that have occurred as well. And so my focus is always trying to apply the most academic and the best level of care that I can. And so some of that is, it might be a little bit more different than the traditional acupuncture appointment that people are used to. But when it comes to chronic disease, I see great results with it. So I'm going to stick with it.
Good. Can you give some examples of chronic disease, like some types of either symptoms or chronic diseases that are really common that people might not be aware of?
Yeah, on the infertility side, two of the most common chronic diseases that I'll see with that would be endometriosis and polycystic ovarian syndrome. And both of those can be huge barriers towards pregnancy in and of itself. And they might require additional work with a fertility specialist doing an IUI or, egg transfer or some sort of like additional fertility work, which I've worked with patients on the past too, working on that medical team. Other cases would be, usually patients will come to me with some sort of a fixed, strange condition that they can't get past, whether that's strange hair loss, a rash that no one can seem to get rid of, or some sort of a pain. And so with the pain, you would expect there might be a rheumatic condition or some sort of an autoimmune connective tissue disease. And it's not always the case. Sometimes there's just degeneration, and we're trying to do our best to kind of maintain things. And then for other patients, they might come in like, you might not think it, but sometimes I'll see patients who have seen everyone for their chronic neck pain, and it turns out they have autoimmune thyroid issues because the thyroid sits like right in the neck,
Mm-hmm.
and that can be a major problem as well.
Oh.
Yeah.
And when you think about new patients coming in, what could a new patient expect in their first visit or preparing for their first visit to see you?
Yeah, that's a great question. I usually try to recommend for patients to wear loose clothing so that we can, depending on what tissue we need to get at or that we're evaluating, I can get in and palpate it. So usually loose yoga pants with a loose shirt and a sports bra work best. It allows us to work fairly easily around that. They can expect me to listen to their case, really dig into the nuance, go over any lab work or imaging that they've had. I usually try to have patients bring their medical folder, particularly, especially like my patients that are going through cancer care, they'll have a literal folder of all of their scans, their
Right.
medical information, and that's usually what they're used to when they go to different medical appointments. I'll go through their case, then we'll start doing more physical assessment that involves a lot of palpation, pulse taking, um, looking at, if there's a rash, looking at the rash too, seeing how broad it is, what the tissue looks like. And then we just go over their health history, and I come up with what's called a report of findings, which goes through my thoughts on their treatment, how long it will be, the level or the extent of how much treatment they'll probably need to see good lasting results.
Awesome.
Yeah,
Um,
it's a lot. It's a lot to cover.
it is. It is. And you mentioned this a little bit before, I think, just in terms of how you're seeing patients now, but maybe you could just underscore a little bit about how patients can feel safe, because I talk to people who are like putting off medical appointments
Oh yeah.
versus, proactively taking care of chronic conditions during this time. And so if you could just underscore a few things that would maybe reassure people if they were going to come into the office, so they can feel safe doing so.
Yeah, that's a great question. And the bigger issue is, how do you're at risk because you have some sort of a chronic disease, but then you need to go get care and help with that chronic disease, but that is a risk in and of itself. So
Right.
this is like chicken versus the egg. How do we
Right.
balance both? And this is the nature of my clinical practice. So already when all of this was coming out, I was looking for every opportunity to make sure that we were safe in the office. And at the beginning, it meant just only seeing patients who were emergency care or very extreme.
Mhm.
Now, right, what I have in the office is I'm by appointment only.
Mhm.
I'm only seeing one patient per time so that I can clean the table in between visits. I used to see two patients in the same room pre-COVID. So now I keep it at one. You're not waiting in the waiting room, so you can wait in your car and then just walk straight into your appointment. And I also have what's called a molecule molecule air filter, and you can actually Google that. So it's molecule with a K, and they are a FDA cleared air filtration system that actually uses UV light to degrade any sort of filtered substances. And what they've actually been cleared for is that they do remove the SARS-CoV-2 virus from the air. So within 15 to 30 minutes, we see massive reduction in viral particulates in the office too. So that also helps to create that clean breathing environment.
Wow, I'm going to look into those air filters.
Oh yeah, they're good. So they have the medical version, they have the in-office version, and they have your home versions too. So they're pretty incredible system.
Yeah, fantastic. Anything else in closing that you would want somebody to know about you or your practice, or about why it's a good time for someone to come in and see you?
Oh no, I think we've covered it. Now's a great time. I try to make sure that everyone's safe coming in the office, as safe as we can make it from what we know now, and so I'm hoping to help as much as I can.
Good. Thank you, Mark. And what's the best way for viewers to reach out to you?
The best way is by phone. My office phone number is 720-295-9323.
Awesome. Mark VanOtterloo, acupuncturist extraordinaire. Thank you for your time.
Thank you so much, Sharon. I appreciate
Yeah,
it.
take care.
All right.
Bye-bye.
Take care. You too. Bye-bye.